Health and medical services are essential aspects of daily life and can also play an important role in business settings, such as ensuring employee well being and handling medical situations while traveling for work. Understanding how to navigate these situations using English is important for clear communication and efficient problem solving. In the TOEIC test, you may encounter vocabulary and phrases related to health and medical services. Here's an overview of this topic from various perspectives, using language suitable for CFR A1 A2 learners. 1. Making a medical appointment. Scheduling an appointment is often the first step when seeking medical care. Phrases like, "I'd like to make an appointment," "Do you have any availability today?" and "What time can I come in?" are frequently used. You may also specify the reason for your visit, using phrases like, "I need a general checkup," or "I have a cold." 2. Describing symptoms. When visiting a doctor, explaining your symptoms clearly is crucial. Phrases like, "I have a headache," "I'm feeling dizzy," and "I've been coughing for 3 days" help medical staff understand your condition. Knowing basic terms for parts of the body and common symptoms, such as stomach pain, fever, or sore throat, is useful in these situations. 3. Understanding doctor's instructions. After diagnosing your condition, the doctor may provide advice or prescribe medication. Phrases like, "Take this medicine twice a day," "Get plenty of rest," and "You need to stay hydrated" are commonly heard. Understanding these instructions helps ensure you follow the treatment plan correctly and recover quickly. 4. Pharmacies are where you can fill prescriptions or buy over-the-counter medicine. Phrases like, "I have a prescription for this," "Do you have something for a sore throat?" and "How often should I take this?" are helpful. Knowing terms like dosage, side effects, and instructions ensures you use the medication safely. 5. Emergency situations. In emergencies, clear communication is vital. Phrases like, "I need help immediately," "Call an ambulance," and "Where is the nearest hospital?" are crucial. Knowing how to describe the problem, such as, "He is unconscious" or "She has difficulty breathing," helps responders act quickly and appropriately. 6. Health insurance and payments. If you're using health insurance, you may need to communicate about coverage and payment. Phrases like, "Does my insurance cover this?" "How much will this cost?" and "Do you accept this insurance provider?" are often used. Understanding these terms ensures that the financial aspects of medical care are handled smoothly. 7. Workplace health concerns. In a business setting, addressing health issues like sick leave or workplace injuries is important. Phrases like, "I need to take a sick day," "I hurt myself at work," and "Can I see the company doctor?" are useful. Companies often prioritize employee health to maintain a productive and safe work environment. 8. Staying healthy while traveling. When traveling for business, knowing how to handle health-related issues is essential. Phrases like, "Do I need any vaccinations for this trip?" "Where's the nearest pharmacy?" and "Is it safe to drink the tap water?" help ensure you stay healthy and avoid unnecessary risks during your trip. 9. Polite communication with medical staff. Politeness helps build good relationships with medical professionals. Phrases like, "Thank you for your help," "I appreciate your advice," and "Could you explain that again, please?" ensure clear and respectful communication. Being polite creates a positive experience and encourages open dialogue. Understanding these aspects of health and medical services helps you navigate various situations with confidence, whether in daily life or during business activities. This knowledge is useful for TOEIC preparation and for building practical communication skills. Being able to handle health-related matters effectively contributes to overall well-being and smooth interactions in any setting.